Thank you for using Houston Thyroid and Endocrine for your endocrinology needs. This video will explain how to confirm appointments, reschedule appointments, cancel appointments. It will also explain our NoShow and NoLab fee policies. When you go to your dashboard in your patient portal, you can see your upcoming appointment. If you click on the Appointments tab, you can see all your upcoming appointments. Here, you can cancel an appointment or reschedule. If you'd like to cancel the appointment, simply press Cancel Appointment. Here, you can explain why and press Submit. If you'd like to reschedule an appointment, please click Reschedule. Note that you should choose the provider, the facility that you'd prefer to be seen, the reason for visit, and choose date ranges that are at least 10 to 15 days ahead in order to allow for proper timing for getting labs done prior. You select your date preferences, first and second, times that you'd like to be seen, best method of contact, and then press Submit. Finally, in order to confirm an appointment, you can simply go to your portal and press Concerns in the Messages section. Send the message to your doctor, to the facility that you usually go to, and in the subject line, please write confirming my appointment for whatever date. That's it. Press Submit, and we will confirm your appointment. You can also alternatively go to our website and chat with us during regular business hours between 8 a.m. and 3 p.m. Central Standard Time and let us know that you're coming to the appointment. Please include your first and last name and date of birth so we know who we're chatting with. Finally, to review the NoShow and NoLab fee policies, you can go to our website. In general, if the doctor asks you to schedule a follow-up visit in the future for an established patient, the doctor may request that you complete blood work at least 10 days prior to your scheduled visit. We call these pre-clinic labs. It's very important to have completed the labs ahead of time so that the doctor can review and give you advice based on those results at a follow-up visit. Failure to complete these pre-clinic labs is called a NoLab, and we prefer that doesn't happen. If the patient does not complete their assigned pre-clinic labs at least 10 days prior to their scheduled appointment, we will need to reschedule your appointment, or if you don't reschedule, you may be charged a $50 no-show fee, NoLab fee. We are not responsible for obtaining lab results that were ordered from a different doctor's office. If they are not in your chart at the time of your visit, you may be charged the NoLab fee, so make sure your other doctors have sent those labs ahead of time, if you're an established patient. Note that new patients do not need to do labs prior to their visit. You do not need a lab paper to go to have your labs done. Most labs that we use include LabCorp and Quest. If you go to a patient service center, they will be able to pull up your lab names and lab order slips by your name and date of birth. You can use the link on our website to find the closest laboratory to where you work or live. If your lab order slip was for LabCorp or Quest, please find their locations on our website. We usually use LabCorp, but if you have Aetna insurance, usually you must use Quest. Find out if your lab order is out of date. If your lab order was created more than 6 months ago, it may be expunged from their lab systems, so you may need a copy of the lab order in hand. We would have given you that at your last visit. You may need to contact our office to refresh your lab orders or to get a copy of the lab slip sent to you. Not all patients need to have labs done prior to their visit. Notably, new patients. You do not need to have labs done prior to your first visit, and patients who we've sent to surgery do not need labs done prior to their post-op visit. Finally, we have a no-show fee policy. Please give us the courtesy of at least 24 hours notice when you're going to cancel an appointment with us or reschedule with us. If you don't give us enough time, we may need to charge a $50 no-show fee. Thank you for your time.